Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to episode 43 of the Lunch and Learn with Dr. Barry. And it is your host, man. I am excited again to be bringing you another interesting topic. And I'm not going to lie, it was recently brought to my attention that I had to talk about seizures only because apparently Wendy Williams had a syncopal episode and fell on national TV live and apparently thinks that it was secondary to a heat stroke. And I'm arguing that I think it's due to seizures. And that's why we're going to talk about seizures today, right? We're going to talk about how to recognize the seizures and what are seizures. And hopefully by the end of today's episode, you will side with me and not my wife that she had a seizure and not a stroke or like a heat stroke, what she was claiming on the TV. So again, if you want my show notes, you're going to head over to drpierresblog.com/LLP043. Again, if you want the show notes for today, head over to drpierresblog.com/LLP043 and get ready for another great episode from yours truly, Dr. Barry. Alright guys, so I need y'all to just sit back and just rock with me on this episode because I'm going to be talking about seizures and I'm going to try to convince you that Wendy Williams, again, if you don't know who Wendy Williams is, just Google her. She's got a lot of memes out already because, unfortunately people are cruel. But if you don't know her, she was on live TV at the time of this recording the day before, or actually I guess the day of, and had a syncopal episode, which in medical world means she passed out. But before she passed out, she exhibited some signs that I'm concerned that she had a seizure. So much so that I actually changed the topic of today's episode just so we can talk about seizures, right? Like I was going to hold on to it for, maybe a later episode sometime later on this year, but I said, you know what, I might as well just bring it up now because, she thinks and she's telling people, hey, I don't 100% know, she could be telling the truth, that she passed out because it was hot. I'm concerned that she had a seizure because it did not look like a person who just passed out, right? So we're going to talk about seizures today, right? So what are seizures? In the grand medical term of seizures, it's a neurological dysfunction, right, caused by abnormal activity in the brain. And when we say abnormal activity, your brain is normally firing electrical signals, pretty much telling your brain and your body to do whatever. Just the fact that me talking, my brain is sending an electrical signal to the part that controls my mouth to talk, right? So your brain is always doing that all the time. What happens, unfortunately, in patients who are dealing with seizures and seizure episodes and a history of seizure is that electrical activity just goes amok. And there's no off switch, there's nothing to control it. And what we tend to see, especially when we think about seizures in the grand scheme of things, is this person who's like shaking a lot on the ground, almost biting their tongue. Like, so the most common way we think about seizures is that like picture, right? So let me just kind of, bring back to, my patients and, what I've seen in the past, taking care of patients in the hospital, taking care of patients in the outpatient center, right? In the inpatient, which is inside the hospital, right? The majority of times, a patient who is having a seizure kind of comes to us, like either when they've already had a seizure and they're on the way, but sometimes, unfortunately, they'll have the seizure, while they're there. In my line of work, I've seen patients have seizures for lots of different reasons, and we're going to talk about those, towards the middle end of the show of some certain causes of seizures. But, a lot of it always kind of starts out the same way, right? Where, like, they notice something going on, they feel like something's about to happen, and then it happens, right? And in the brain, when you have this electrical activity that's normally going like it's supposed to go, and then all of a sudden like starts running amok, that's what tends to happen, right? It always gives us what we call like this little, almost like an oral like sensation, right? So it's pretty much a signal that say, oh, something is about to happen. I don't know what is about to happen, but something is about to happen, right? So when we talk about seizures, we talk about couple types of seizures, right? And we'll talk about the two different types of classes again. I just want to, especially when we do these lunch and learns, right? A lot of it is more for education, so you can take what you learned today and then build on it, read up on it, and then be able to discuss with your doctor. Follow up, and because that's all the goal, right? Making sure you follow up, making sure we're empowering you, to be educated when you walk into your doctor's office, right? So we got two types of seizures, right? We got a generalized seizure and we got a partial seizure, right? So what's the difference, right? When you say, what is the difference, Dr. Pierre, of those two types of seizures, right? So a generalized seizure is electrical activity that happens all over the brain. The whole brain, electrical activity just running wild and running amok and nobody seems to control it, right? That's the generalized type seizure. Those patients who have these generalized type seizures, they can either have what we call motor dysfunction, and again, when motor dysfunction is when you see a person shaking uncontrollably and fall to the ground and eyes rolling back ahead. They can have that. You have some patients what we call a diagnostic of atonic seizure, right, where their body goes limp, and then they just fall to the ground, right? So this is a person. We think about seizures classically. We're thinking about that person who is shaking all over the ground, about to bite their tongue. But there's also that case of a person who, instead of their body getting all tense and stiff like a rock, their body just gets limp like a noodle and drop to the ground, right? So that's a different type of seizure. Again, that's under that general classification, right? And the partial seizure, just like kind of like the name says, instead of general where the electric activity happens all over the brain, the partial seizure, the electrical activity happens just in a certain section of the brain, right? And if we can kind of think about it in like the grand scheme of things, right? If I have a problem with my brain and all the electrical activity is, going crazy everywhere, then I expect to see a much bigger reaction from it, right? So I expect to see much more bigger outwardly presentation of it, right? That's where you get that tonic-clonic situation where my body is like a rock, it's tense, but I'm shaking like crazy. In the partial standpoint, if only a small part of my brain is, got that electrical wiring that's going crazy, then only a small portion of the body should be affected, right? And again, it may not be, one side in terms of like my right arm, my left arm, but it may be maybe my senses, maybe the sense of smell is kind of weird. Maybe I'm getting numbness, maybe I'm getting tingling, right? So there's a different, from a spectrum standpoint when we talk about seizures, but it's important to note because again, when you see, the typical case on TV, where this person starts seizing and they're foaming at the mouth, those are going to be your generalized seizures, right? Because that's happening all over the body to the point where your whole body is affected. You all on the ground. You don't know what's going on. You just know something's happening bad to you, right? And that three parts of a seizure, right, is that first part is what I kind of alluded to, right, when I talked about the aura, right? Patients who have, seizures, right, especially the ones who have the history of it, they'll tell you, and a lot of times when I see them in a hospital setting, when I see them in an emergency room, I'll ask them, before you passed out, did you have any weird smell? Did you have any weird, sound? Did you hear any weird sounds? Did you do any, funky looking, fidgeting, facial expressions, right? Did something happen before, the big event, right? Because, again, seizures, unlike stroke, right, they give you that warning sign, right? Like, if you had a stroke, there's no warning sign. There's no, my body's going to be trembling, shaky. No, you're just, boom. Stroke happens, right? Like you're talking normal 1 second, next thing you know, you're not talking normal, right? So again, I want you to kind of differentiate that, right? Like head over to Dr. Pierre's blog.com and search for the word stroke, right? We've talked about stroke before, trying to recognize the signs of stroke, right? Today we're talking about seizures. So these seizures, they give you that warning sign, right? Stroke, no warning sign. Seizure, give you the warning sign. So you got that aura sensation. That's the start of, the seizure that's about to happen, because it is going to happen. And then you get that physical phase, or that phase where something is going to happen, right? And it may not be, you're on the body convulsing, or you're twitching, or you're foaming at the mouth, right? But maybe your right arm is twitching and you can't move it, right? Or maybe your whole body gets limp. Like, something is going to happen in that stage, right? Like, that's usually the stage people start freaking out and calling 911. That first aura stage, no one really knows. You most of the time, you don't even tell someone something's happening, right? You just say, I wonder why am I, like, all of a sudden, smelling, vanilla extract or something weird. I've had patients say they smell all kinds of weird things and smell all kinds of weird things right before the seizure happen, right? Because again, remember, the brain controls everything, right? So the brain normally sends electrical, signals that say, hey, this is what a vanilla extract smells like, right? But if you're having a seizure, all of a sudden your brain is just throwing all kinds of signals that you don't know what the hell going on, right? So you say, why am I smelling vanilla extract? And then you're on the ground, right? And then the seizure is like kicking your butt. The third stage is the stage that a lot of times in the hospital setting, patients will come into the ER with, right? So patients who are usually brought in by, emergency medical services, the fire department, friends, family, when they come in this stage we call the post-ictal stage, right? And what is post-ictal stage? We already talked about the ictal stage being that middle stage where things happen. We're not sure what the thing is. It's usually physical, but again, it could be numbness, it could be tingling, it could be something that you may not notice. But that post-ictal stage occurs is now you're like in a fog. You're kind of confused. You're kind of dazed, but you are aware. You're able to answer questions, but you're just kind of out of it, right? For the patients who suffer from a generalized seizure, again, remember the generalized seizure is the big boy, and that's the one that electrical signals is firing all across the body. When patients suffer from that generalized seizure, their post-ictal stage usually tends to be a little bit longer, and they tend to be a little bit more out of it, right? So a lot of times I can't even get, a good history from those patients, right? And, my fellow medical folks who are following the podcast understand what I mean when I say that, where you're trying to ask them a question, but this person is like outwardly confused, right? They're like, I don't even know why I'm here. The last thing I remember is I was smelling vanilla extract, and next thing you know, I'm in the ER. And you're asking me weird questions like, did I bite my tongue? Did I pee on myself, right? Like, because, again, that happens. Remember, your brain controls everything, right? So normally you hold on when you don't need to use the restroom, right? You say, oh, I don't need to use the restroom, but I can hold this on. But when that brain is firing like crazy, all of those signals that, are good to try to protect yourself, especially from a little public humiliation, like peeing on yourself, like pooping on yourself, that goes out the window, right? So a lot of times my question is kind of centered around that, right? And I'm going to talk about, the scenario of what I do when I see patients in the hospital and they've had a seizure, what type of questions I tend to ask them. You may be thinking, all right, I've got the seizure. I'm in the ER right now. What the hell happened, right? Like, how did I even get here, right? The causes of seizures, they're broken up into two groups. Again, in medicine, we love groups, right? Because groups helps us remember things a lot easier, right? So when you go to see your doctor, and if you have that history, or you got family with family history of it, and, you start asking these questions, a lot of times we will put you in groups because it makes it easier for us to remember, one, but it also helps it make easier to treat. So that's a good thing for us when we talk about putting you guys in groups. So the seizure is, from a cause standpoint, let's think about two groups of it. It's either natural or it's provoked, right? So either it's natural, it just happens, or something causes it, right? Let's focus on the natural, right? Because the natural one was easy, right? Genetics, right? And again, I know we hate to think about it, but like our mom, our dad, our grandma, our grandpa, they are a big reason we're dealing with a lot of the stuff we're dealing with now, especially when we think about the health issues in that concern, because they pass down everything to us, right? So if they pass down the good stuff, the looks, the fame, the name, they're also going to pass down the bad stuff, right? Being overweight, having diabetes, having seizures, right? So genetics is a number one, I don't want to say number one, but genetics is a huge cause for natural causes of folks who are having a seizure, right? So these are patients who've been dealing with seizures all their life. Since they've been little kids, they have been dealing with seizures, right? Infection again is a natural cause, right? It's not. You may think like, oh, why is that a cause, a provoked one? But no, think about it. It's actually an infection due to lots of different things, right? An infection due to something that a bug that may have jumped into your bloodstream and now it's at your brain, right? An infection, that may have, started off as like pneumonia and now it's in your brain, right? Something that's causing you to be so overtly ill that arises, right? Think about that when we think about, an infectious cause from a natural standpoint, right? Birth issues, right? So persons who've been born with certain birth defects, especially neurologically, can also deal with the stress of dealing with seizures, as they get older, right? So that's another risk factor associated with seizures, right? So we got genetics, we got infection, we got like birth-related issues, certain neurological related issues as well. We're going to add that on there. Can be associated with a natural cause for a person suffering from a seizure, right? So let's move on, right? So our second group is the provoked causes, right? The provoked causes are those that something that we tend to do that it gets inflicted on us that causes us to have a seizure. Provoked causes, number one, I got to start out with is going to be my alcohol or drugs, right? And so let's talk about alcohol first, right? Alcohol, for those who are your weekend bingers, tends not to be a bad thing while you're consuming the alcohol. But what happens, especially for alcohol-related seizures, and this is usually my patients who are like chronic alcoholics, is that they may go on a binge where they're drinking hard liquor for weeks, and then all of a sudden say, you know what, I want to quit cold turkey. And your body is not ready for that, right? So you can end up actually having a seizure from alcohol withdrawal, right? Which kind of like sucks, where you think, well, I was drinking alcohol and you told me the alcohol was bad. I stopped drinking alcohol, then I had a seizure, right? So alcohol withdrawal is a big one. The same thing from a withdrawal and actually a toxicity standpoint when we talk about some of these drugs, right? The biggest ones are like your benzodiazepines, AKAs your Xanax, your clonazepam, your Valiums, all of those medications there. If you, for some reason, you miss a prescription, you're taking, too much, and then all of a sudden you drop down too low, that can cause a drug withdrawal seizure, right? So that's especially that class, that benzo. Now, there's a lot of different other medications that can cause seizures, but like I wanted to focus on that one, especially because I know a lot of my listening audience, may partake in those types of drugs, right? Now, trauma. Trauma, again, is, probably an obvious cause, right? But if you get in an accident that causes some head trauma, remember, if the electrical brain activity ain't firing correctly, right, you have an increased risk for suffering from a seizure. And next one is stroke, right? Some patients can suffer from a stroke so severe that it actually causes you to have a seizure, right? So if you have a stroke, I see this a lot from my patients who suffer from strokes that cause a bleed. And if you follow the blog post when I talked about strokes can be classified either from a bleed or a clot. So a lot of times when I see my patients who've had strokes from bleeds and who've had to have some type of surgical treatment, a lot of times we'll put those patients on anti-seizure medication, just to make sure, right? Like just to say, hey, you know what? You have such a high risk for, getting a seizure because of this surgery you just had, to get rid of that blood that was in your head. Let's make sure that we kind of protect ourselves from that. Next is brain cancer, right? Or just say tumors in general, right? And this, especially when anyone has a headache, anyone has a seizure, they always assume they have the brain cancer. But in a seizure episode, right, especially a person who's been seizure-free all their life and randomly just starts having seizures, that's something we get very concerned about. We want to know, like, why is this person all of a sudden having seizures when they've never had a seizure before, right? So that's something to think about, when we think about brain cancer. I know a lot of you, you get a headache and you say, oh my God, that's it, I got brain cancer. That's not the case. Most of the time, it's due to secondary issues. But, for that person who may be like 45, 50, 60 years old and all of a sudden has a seizure, right? And, we've already kind of said, we've already kind of ruled out that they're not an alcoholic. They didn't stop taking certain medications. There wasn't any trauma. There wasn't a stroke. We get very concerned that a cancer could be a big cause for it, right? So again, we talked about natural, we talked about provoked as far as the causes of seizures. Diagnostic imaging, right? Like, so what tests, if you walk into the hospital, like what tests are we running just to make sure you've actually had a seizure, right? So there are actually blood tests that are elevated, in signs of, in the settings of you having a stroke, in particular prolactin level. I can tell you most people tend not to get, especially from a clinical standpoint, because the prolactin level is a very sensitive test. So a lot of things can cause it to rise, not just necessarily you having a seizure. So we don't tend to order that very much, at least in my hospital, because of it. Your hospitals may. There's certain blood tests we'll do. Again, I have to rule out, that maybe some of the, provoked issues that cause you to have the stroke is maybe an electrolyte imbalance, right? Maybe your potassium's too high, your calcium's too high. Maybe one of those, something's out of whack, your sodium's too high, your blood sugar's too high or too low. That's an important one, right? I didn't mention that. Blood sugar is a big cause for concern, especially when we're thinking about seizures and strokes in that regards. So, we'll do some blood tests just to make sure all of your blood tests are in the normal range. Because if they are in the normal range or aren't in the normal range, then that's something we need to be concerned about. From an imaging studies, the big one is going to be the MRI. Again, remember we talked about an MRI because we want to make sure this person right here is not having a stroke. And we want to make sure that this person right here, doesn't have brain cancer, right? So, we've already got to the point where we've taken medications away. So we can't blame the medications. We can't blame an infection. We can't blame you drinking alcohol and stop drinking alcohol 2 days ago. So we got to start making sure that there's nothing inside the brain that's causing problems, right? So, MRI is another one for us. Now, the most diagnostic, test that we tend to see, done in my ER is the EEG, right? And the EEG, again, you don't even need to know the rest of it. Just Google EEG and you'll see what that looks like from a picture. In fact, what we'll do is we'll actually put a picture of what a person with an EEG looks like, and then we'll have a link to a video of someone getting an EEG. That's a very diagnostic test for patients suffering from seizures. And why do we do the EEG, right? Like, why is the EEG important? Remember when I talked about how seizures are your brain sending crazy electrical activity, sometimes everywhere, sometimes only in certain areas? The EEG, and it's electrodes that kind of connect. There's a whole bunch of them. I want to say it's actually a whole bunch of electrodes that connect to your brain that can pinpoint where your electrical activity is firing. So it can tell us if you got, electrical activity in a small area, or you got electrical activity in all parts of your brain, right? So that's something we tend to do a lot in the hospital, at least here at Wellington Regional, for diagnostic purposes. And treatment aspect of it, a lot of it is just medications, making sure we treat whatever the problem is, right? Again, if this is a provoked issue, let's say it's due to alcohol and alcohol-related seizures. We don't give you alcohol, so let me stop you there, right? Let me stop the thinking. We're not going to give you alcohol, even though I've been told that there's certain hospitals, I think maybe like the VA, that will, give patients alcohol while they're in the hospital, just so, they don't seize while they're in there. Because again, the patient who, coming through the hospital of alcohol withdrawal, they will stay there for a few days just to try to get over it. And, in the hospital setting, right, you're trying to get those folks out of there just as quickly as they got in. We'll make sure there's no infection, right? So, we're checking our blood tests. We're giving antibiotics, antivirals, if it's like a meningitis type picture. So we'll do all those things to try to eliminate, a provoked cause for the seizure. Now, when we talked about, let's say if it's genetic, right? Or let's say we've eliminated everything and you're still having seizures, we got plenty of medications, right, to give you to make sure those seizures are under control, right? So it's going to be very important, especially if you know any loved ones who have suffered from seizures or who are dealing with seizures now. Make sure they're always taking their medications. I tell you, Dr. Barry, if I had a nickel, right, for every time I told one of my patients, if you don't take your medications, this is going to happen, and they don't take their medication, and blank happens, right, like I'd be rich, right? So always, 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 if you have any family members who are on seizure medication, supposed to be taking seizure medication, suffer from seizures, please make sure they go to the doctor's office. Please make sure they're getting their medications. There are some surgical treatments of it, of the seizure disorder, and those are usually reserved for patients, usually the younger patients, even older patients, but usually younger patients who are suffering from recurrent seizures. That medications is where we start at, that medications don't really seem to help us, right? So, I want to kind of bring it all together, right? We're talking about seizures today. Remember, seizures is an abnormal electrical activity that's causing the brain to fire like crazy. Maybe it fires in certain parts of the brain. Maybe it fires everywhere. We talked about the two types of seizures. They got the general and you got partial, right? And general means electrical activity everywhere. Partial means electrical activity only in certain places. And both of those will give you an idea of what they may present, right? Like what that person may look like based on the type of seizure they're having. We talked about the 3 stages of seizures, right? We talked about that aura stage where you just kind of feel something about to hit you, and then boom, it hits you again. You smell that weird ass vanilla extract, and then all of a sudden you're on the ground, you're in the ER, right? Like you smell vanilla extract 1 minute, next thing you know, you're talking to someone like me in the ER. In that post-ictal stage is that third one where you're just kind of like out there, you're kind of confused, and you know what's kind of going on. So we got aura, we got the ictal stage. Again, that's where the thing is actually happened, and you got the post-ictal stage. Causes, again, natural, provoked. Remember, when you go to your doctor's office tomorrow or next week or whenever you go see them, and you want to talk about seizures, remember, natural, provoked is genetic, infection, birth-related issues. That's your natural side. Versus some provoked issues, whether it be alcohol, drugs, trauma. You having a stroke, even you having cancer, right? So definitely important to be able to kind of tell the differences and think about the differences when you're asking questions, when you're looking up all these things. I know a lot of the people who listen to the podcast, they always tell me that I tend to give them homework because they end up looking to try to read up on more, and that's really the goal, right? That goal is to make sure that you guys are as prepared as possible to take care and take back your health, right? Diagnostic is, again, we got the blood test just to make sure that it's not drugs, make sure it's not alcohol. We got the MRI just to make sure it's not cancer. We got the EEG, which is the definitive one. It's a whole bunch of electrodes. Remember, you're gonna check out you're gonna check out those show notes, drpierresblog.com/LLP043. You're gonna check that out so you can see a picture and a video of what an EEG looks like. And on treatment, really, it is just trying to deal with the cause, and if the cause is something that we can treat, we're going to give you infection, we're going to do surgery, we're going to do medications, whatever. The goal of it is to really try to stop you from having a seizure, right? Because let me tell you, when patients come to my hospital, right? It's mine, sure, whatever, we call it my hospital. When patients come to my hospital, and let's say they've had a seizure for the first time, right? And I get that a lot. The first thing I got to do, I got to tell my case manager, hey, can you send a letter to the DMV so that this person can't drive for the next 3 to 6 months, right? Like even before I even get to say your name right, someone's already sending your information to the DMV to say, hey, this person can't drive. And before you leave the hospital, I'm going to remind you that you can't drive for at least 3 to 6 months, right? Until a neurologist clear you, which, again, usually doesn't happen for 3 or 6 months. So think about that, right? I can't put a person out on the road who just had a seizure, because if they have a seizure and they crash and they kill themselves, let alone kill somebody, you're going to be wondering why Dr. Barry sent this person out the door, right? And that's not going to happen on my watch, right? So you're not going to be driving if you had a seizure with me, right? So that's just something to think about, right? And again, so I'm gonna give a couple of patient scenarios of how I usually will ask questions and deal with patients in the hospital setting who suffer from seizures, right? So number one is my alcoholic, right? This is my alcoholic patient. We know he's an alcoholic. He knows he's an alcoholic. He's been drinking all day, but he stopped, right? He stopped like 3 days ago, right? And now he's feeling weak. He's feeling confused, right? So from my perspective, right, and this is because he's just had a seizure and someone brought him in, right? So I gotta know, right? I gotta know, did you wet yourself? Did you poop in the bed? Poop on yourself. I gotta ask all of these, really specific questions, right? Because I gotta see how bad the seizure was, right? I gotta see, was this the type where, your friend just kind of passed out and then he did these things? Or was he like shaking uncontrollably? Was he foaming at the mouth? Like what type and how did he look when he was having a seizure, right? Because that's why it's so important, in this setting, right? Because I want to know whether I'm dealing with general versus a partial, because the treatment is different, right? Again, that's why we split up these categories, because I know if you're on one category, I might have to treat you different than if you're in another category. So that's that person, right? So a lot of times, we're watching the alcohol. We're actually treating you with medications to make sure you don't have a seizure while you're in the hospital, especially for those who come with alcohol intoxication and we're concerned about alcohol withdrawal. Because for those patients, let's say if you had a patient who's a strong alcoholic and they end up in the hospital for some random thing, it only takes about 2 to 3 days, right, of not drinking that alcohol before a seizure can happen, right? So we are very on point of dealing with patients with alcohol issues, alcohol, withdrawal concerns in that regards. So that's something always to think about, right? So let's think about my 60-year-old patient, no history of seizures, and he has a seizure episode. He crashes his car. He's okay. He's a little confused. I'm going to bring him into the hospital. Again, I'm asking him, essentially these same questions. Did you have any weird symptoms, any weird feeling before, you had the seizure, right? Like, hey, did you smell some vanilla extract, before you crashed into that pole, right? Like, that's a question I gotta want to know, right? Like, I want to know because that's how I'm gonna know how to treat this guy, right? So I'm gonna ask him, did he have any of those aura sensations? And after he had an aura sensation, like, what was the ictal phase look like, right? Was he just kind of like dazed and confused? Because again, I think a lot of us, when we think about seizures, we always think about this person who's like, foaming at the mouth and they're shaking uncontrollably. But there's a lot of patients who suffer from what we call absent seizures, which is really absent of that tense, muscular contraction. And they're just staring off into space, right? And a lot of times kids suffer from juvenile type seizures in this way, where the teacher thinks they ain't really paying them no attention, but what's happening is they're actually having seizures over and over and over again, but you just think that this person is staring into the blank space, right? So think about that. Especially my teachers who follow me, and if you got a kid who just seems to be okay and all of a sudden will just stare off into space, for about 5 to 10 seconds just randomly, and then get back and then not know what's going on. So that's something to think about. And so let's wrap it up, right? Because again, our main premise, right, is I think Wendy Williams had a seizure on TV, and I think she lied, because when you see and I'll put a link in the show notes to her video. When you see her, right, she is, she's standing at I think some podium or something. She's talking, and then all of a sudden, right, she just like glares off into space, does this like herky jerky motion, and then boom, she drops on the ground, right? Like, now, does that sound like a stroke? Nah. Like, that sounds like a full, strong seizure for me, right? And again, I'm not, her neurologist or her internist, and I can't 100% say that's a seizure, but like, if I had to bet my money, if you said, Doc, do you think this is a heat stroke or this lady having a seizure on live TV? It's a lady having a seizure on live TV, right? Remember, guys, especially in the hip hop community, Lil Wayne suffered from seizures all the time, right? Where is his seizures? His seizures are provoked, right? Because that's a person who should be taking medication, but he taking a lot of drugs that's causing those withdrawals, and then boom, he has a seizure, right? So just to give you an idea, right? I think Wendy Williams had a seizure. Again, if you disagree with me, let me know. Drop it in the comments. Drop it in the comments on the website. Hit me up. Drop it in the comments on Apple Podcasts. I'm gonna say iTunes. It is Apple Podcasts. They changed their name. Drop it on the comments and say, hey, I think Wendy Williams had a stroke, or I think Wendy Williams had a seizure. Right? I think seizure. My wife thinks stroke. And we're just gonna kind of end it there, right? So I leave this episode 43 with you guys. Remember, guys, Dr. Pierre. I'm an internist. I'm your program director at Wellington Regional. Blogger, podcaster, and again, when I do these podcasts, I don't do it for me, right? I don't necessarily need to learn about seizures. I do it for you guys, right? Because I want to make sure you guys are fully equipped and fully ready to take back your health, right? Because that's something that I've always seen has been a problem in my, my quote unquote illustrious career. So I've been out of, I joke, I've been out of medical school since 2011. Yeah, 2011. And so, it's in medical years, I've only been doing this for a very short time. But, I've been blessed to be doing a lot of things in this very short time, right? So if you don't take that away, right, remember, right, Dr. Barry, right, does not get anything extra, right, from doing this podcast, right? Dr. Barry does it because he wants to empower you, the listener who's listening to this voice right now, to be empowered and be able to say, I'm ready to take my healthcare back and prevent the preventable death. I'm going to see you guys next week.
Thank you for listening to another episode of the Lunch and Learn with Dr. Barry. I want to say thanks again for all that you guys do and all of your support and all of your listens. So I want you to kind of keep on keeping on with going ahead and sharing today's episode. Go ahead and subscribe to the podcast if you're not already subscribed to the podcast. Follow me on Instagram, Twitter, and Facebook, all at the same name, Lunch Learn Pod. And go to the website again, lunchlearnpod.com, for all of the episodes if you've missed one. And again, I'm at all of the favorite podcast apps: Google Play, Stitcher, SoundCloud, and of course Apple Podcasts, where I would love a 5-star review. And tell me what you think about today's episode. I would love to hear it. So I'll see you guys next week. Bye.